Hi everybody, Joel Palmer here at Vintage Fitness Studio of Vermont. How many of you out there suffer from mid-back pain or that gnawing, nagging pain you get right at the base of your neck where your neck and your shoulders come together? Or maybe it's not a chronic issue, but it's an off and on issue. If anybody out there ever suffer from that? My experience in my office, it's very common. I hear about it here in the studio a lot as well. And a lot of that is attributed to the fact that we are a modern world, and a lot of the things we do put us in poor postures that create a lot of stress and strain on your mid-back and cervical thoracic junction. If you think about it, things like sitting in front of a computer, mousing all day, texting with your phone, gaming systems, even driving for long periods of time, desk work of any kind. If you're somebody who works, say, on a line and you have to work over a bench all day and you're sort of hunched over your work, a cashier who might hunch over and drag things across a scanner all day long, maybe a mom who carries a baby around on her hip all day. All these things can create a lot of excess tension in the mid-back and cervical thoracic areas and create a lot of chronic irritation. So a lot of the things we do tend to pull us forward, and those muscles that you're affecting are postural muscles that are supposed to hold you upright all day. Well, if you're flexed forward and pulled forward all day, you're pulling and stretching and irritating those muscles constantly, and it becomes a problem. So I'm going to show you a simple thing you can do, a really short, easy workout. We recommend it for my patients at my chiropractic office. I recommend it to clients here in the studio. We often use it as a warm-up or a cool-down, or sometimes we even make it a station in part of our workouts, but it'll help you to combat this problem. And not only will it strengthen the muscles between the shoulder blades and at the base of the neck, but it will help to pump some good, healthy, oxygenated blood back into that area. Part of the problem is with these postural stressors, you're getting a lot of stagnant blood pooling in the area, and all those inflammatory compounds like your lactic acids, your pyruvates, serotonins, bradykinin, prostaglandins, all these things that cause that noxious irritation build and then aren't flushed out properly. So these simple exercises will help you flush that area, keep that area mobile, keep that area strong. I wish I could claim that these are my brainchilds, but they are not. I'm borrowing these exercises out of this book. It's called Workout by Design, written by Dale Greenwalt and Eric Miller. And I've actually had the pleasure of talking to Mr. Greenwalt. They have a section in this book called the Daily Dozen, and we're going to use some of those exercises. He claims that he found the same problem working on his own clients, and everybody who he saw had problems sort of between the shoulder blades, and mostly because of the postural stress they're under on a day-to-day basis. So we're going to show you just a couple of exercises. Very simple. You don't need any equipment. My suggestion is this: if you're somebody who has to sit at a desk all day or sit at a workstation all day, I suggest get up out of your chair to do it. You can do these sitting, but if you can, get up. In fact, it's not a bad idea to get up, maybe walk a couple laps around your desk just to get your blood pumping a little bit, and then do these simple exercises. So I'm going to put this down and show you. The first one we're going to do is something called triangle to square. And what I want us to state at the beginning, for all these, it's important to hold yourself in a good, tall posture. You know that analogy is like somebody pulling you up by the top of your head, right? So you want to stand nice and tall. If you do these all hunched over, completely defeats the purpose. You might as well not even bother, okay? So get yourself tall. In fact, as you stand tall, you should actually engage some of the other muscularity. Squeeze your quads tight. Squeeze your butt tight. Hold your brace with your abs. You want to get a little bit of core work while you're doing this as well. So the first one is called triangles to square. We're going to hold our fingers out in front of us, eye level, in a triangle fashion. We form a little triangle with our fingers, and then we're just going to pull the arms back, almost like you're being arrested, back to here. The fingers should point up. They're not out here. Point up. We want this rotation through the shoulder. and pull back and down slightly. So the shoulder blades will pinch together and pull down. And I also suggest just look up a little bit with your eyes. It gets you in a good posture. So you pull back and down and extend. So from the side, just so you can see it this way, triangle to square. Squeeze the shoulder blades just a second or two, and then reach out again. Triangle to square. And from the back, you can just kind of see the motion from the back. Triangles in the front, pull back to the square. Triangle to square. Good. That's exercise number one. Second one, reach and pulls. Almost like rowing a boat. Okay? Reach out here, palms down. As you pull, you're keeping the arms sort of horizontal here. You're pulling straight back. And as you pull, you're going to supinate your hands. Turn your palms up. Supinate here, palms up. Squeezing the shoulder blades again, standing tall. Open up your chest and squeeze the shoulder blades, and again, look up a little bit. So palms down as you're extended, palms up as you're contracted. And you're trying to pull your elbows close to your rib cage. Try not to flare the elbows out and make a big swooping motion out of it. Nice linear motion here. Again, from the sides, here, palms down, reach, pull, reach, pull. And as you get the pull, squeeze the contraction just a second or two. Hold it, and again, reach. And again, I'm contracting with the rest of my body, squeezing my quads, squeezing my butt, reach, pull. From the back, just so you can see how it looks from behind, reach, pull, reach, pull. Okay? Reach and pulls. The next one we're going to do, he has a longer name for it in his book. We're just going to refer to it as open ups. It's like swinging open a door. Your arms are the door, holding your arms at this 90 angle. So you've got a 90-degree bend at your elbow, 90-degree here, shoulder joint, both arms. Doors are closed, and then we are just simply opening up, close, open up, close. And again, look up a little bit towards the ceiling. And as you do this, your whole extensor mechanism is working behind you. That erector spinae group, your glutes, your quads, your hams are contracting, your abs are staying tight. Here. From the side, open ups. Here. Close. Open up. Close. Open up. And again from the back, open ups. Here. Here. To here. Here. Nice. So, those are your open ups. Next one we're going to do is just a simple cervical rotation. You want to try to maintain mobility in the neck. Many of your neck extensor muscles actually travel fairly far down into the thoracic spine, so they'll have extensions that run right down between the shoulder blades. So you want to incorporate some neck movement as well. So simply put, we're just going to stand, good posture, good attention, right? And then just rotate right, almost like you're trying to look over that shoulder, trying to keep the chin sort of level, parallel to the floor. You don't want to get too flexed or too extended, right? So rotate right, squeeze it a second, stop in the center, pause, rotate left, hold it, come back to center, stop, pause. Always pause in the center. Try not to make a habit of whipping it to the other side, okay? Especially if you've been sitting at a desk for too long, driving for a long period of time, or static for a long period of time. Those muscles will be a little stiff, a little tight. You try to whip it around, it's a good chance to pull something. So you want to stop in the center, let your body adjust, and then move again, okay? So again, rotation here to the center, and again, good posture. I'm bracing with my abs, I'm using my quads, I'm squeezing my butt. Rotate the opposite way, back to center. One last one we're going to do, just a trap stretch. Those traps get a lot of use, especially sitting at a desk. So what we're going to do is we're going to hold your arm behind you. So if I'm stretching my left trap, I'm going to actually hold and anchor my left wrist here. And you're just going to sort of press it down. You can even pull it to the other side a little bit if you want. And then, again, standing at attention, tipping my right ear towards my right shoulder. So I'm going to tip away from the arm I'm holding. So I'm holding my left arm. I'm going to tip to the right. Here, I'm just going to hold it. I'll give it a good 10 seconds or so. And then when you come out of the stretch, don't snap out of it. Ease out. Okay? From the front, it looks like this. I'm holding now my left wrist again, holding it, tipping away from the left wrist. So I'm tipping towards the right. Again, standing at attention. And I'm just going to tip, stretch that trap. All right? And then ease back to the center. Again, don't snap it back. Ease back. Then you can switch your grip and just tip the opposite way. Okay? Back to the center. The last one I'm going to show you, simple shoulder rolls, reverse shoulder rolls. The idea is to almost exaggerate the roll and really puff up your chest and squeeze behind you, okay? So it's nothing where you've probably all done shoulder rolls, but go slow and controlled. You don't want to do this too fast. The idea is to try to engorge that posterior area with some good healthy blood. So you really want to sort of work the muscles. So we're going to just go up, back, around, squeeze. I'd like to pause a second and then back down. Up, around, and down. Again, it's good to just sort of look up a little bit. That will engage your neck extensors a little as well. Hold your posture in good form. And squeeze. And you can see I'm trying to actually open up my chest here and squeeze the shoulder blades. And one more time from the back. Shoulder rolls. And there. Okay? So those are the exercises. How you do them, totally up to you. In the book I showed you, they call it the Daily Dozen because there's a dozen exercises that they recommend you do daily. But this is an abbreviated version. It's designed to be done quickly, and you can do it multiple times a day if you want. My suggestion is this: if you are a person that has a sedentary job, you sit at a computer or you're on a phone all day, or you text all day, or you drive all day, again, stand, do these. Just do 5 or 6 repetitions of every exercise, except for maybe the trap stretch and the cervical rotations. You know, the stretch I just do 2 or 3, okay? But the other ones do, 5 or 6 of each of the exercises. Get up from your desk, walk just for a couple seconds, do your exercises, back to work you can go, okay? And a good method is to actually do this halfway through your morning, again, halfway through your afternoon. If you get a lunch break, if you want to throw them in there during the lunch break, perfect. It won't take you a lot of time, but you'll see that it helps to kind of cut down on some of that, just that chronic irritation that a lot of people get in that cervical thoracic area, okay? So try them out, simple, easy to follow, wing it if you want. It doesn't have to be hardcore, and it doesn't have to be a certain amount of sets and reps and all that nonsense. Just to take yourself through the motions throughout your workday to try and help yourself overcome some of the chronic buildup of toxins in that extensor area. So try it at home. Let us know what you think. Keep your eyes open. We're going to show you some other things. I've got some neck exercises I'm going to show next time I do a video, and some real simple ones that you can do for people who have neck issues. Some simple rehab, strengthening kind of things. Again, you don't need any special equipment for. So keep your eyes open for that video. And thanks for coming and watching here at Vintage Fitness Studio Vermont. And remember, life is heavy, train for life, and we'll see you next time around. Take care.